into allegations of mismanagement at an organization with a remit to foster economic development in the oil-rich Niger Delta region. Daniel Pondei, who is the acting managing director of the Niger Delta Development Commission (NDDC), was taken to hospital after slumping forward in his chair during the session in which he gave evidence to the panel. Lawmakers in the House of Representatives, the lower chamber of parliament, are investigating alleged corruption around procurement at the NDDC, a government body over 20 years. The probe was ordered by President Muhammadu Buhari.
Welcome back again to the channel. You see your favorite girl, UJTV. Whenever people come down here to Ghana, they have something that would shock them. They have one or two things that is going to sweep their feet off the ground. The video I'm going to be sharing with you today is a video of Nigerians in Ghana. Nigerians coming to Ghana. The first time they came to Ghana, or the first time they went to use a government hospital here in Ghana. You know, the experiences are just too much. When I tell you that you have the likes of those ministers, Lamborghini ministers, that when they come to Ghana here, they'll keep on fainting. They'll be surprised that, is this thing actually in Ghana? That is what happens to most Nigerians whenever they come down here to Ghana. Let's take a look at the beautiful hospital, the facilities, the things they have, what they have to say about the Ghana government hospitals. Then we'll come back to the video and have a deep conversation about
beauty and the cleanliness of this hospital. When I fell ill, I panicked because I honestly did not know where to go. I'd never been to a hospital in Ghana for an emergency, and I feel like you hear nothing but horror stories when it comes to hospitals in Ghana and just general negativity about the healthcare system in Ghana, which I'm not saying are not true, but are just things that made me panic when it was actually time to use the healthcare system in an emergency. But staying at this hospital honestly really put my mind at ease. And I know exactly where I'll be going if, God forbid, I just got a 9 out of 10, and I really do hope to see hospitals of this quality across all regions in Ghana someday.
The main purpose for setting up UGMC was to give cutting-edge clinical services, and then also to train medical personnel and then carry out research that all has to do with operations of the service.
The University of Ghana Medical Center was conceived as an academic medical center. In other words, it was set up to train health professionals to the very highest level, but it was also expected to do cutting-edge research to help discover new medical innovations, new treatments, to test new vaccines and new medicines. But in order to provide an opportunity for training and also to do research, it needed to offer patient services to ensure that you can attract the number and the type of patients you need in order to do research, but also to do training. So that has led to the center having these three objectives.
The Ministry of Health had played a huge role in getting UGMC fully completed and very well established at the moment to do what it takes to actually deliver healthcare services. I joined the ministry when phase 1 of the project was about to complete. But the way the project was designed, we couldn't operate significantly without the phase 2. So initially there was pressure that we should start operationalization. But we insisted that we needed to complete fully, or at least some portion, significant portion of phase 2 to be completed before we could do the work. Because UGMC had been established as part of the teaching hospitals, we didn't find any law, they were not in the budget. So the initial releases to that place was passing through this ministry until we got to a stage where they could actually win themselves from us. But when they were fully established, by recruiting people they needed to run the place with, they applied, they got permission to actually set up their own tender committee to do the procurement.
The objective of the facility, the equipment required to give that kind of quaternary services was provided by the phase 2. And at the end of it, all the three vital areas, like the medical observation and training center, the clinical services and the research, are already at the end of phase 2. And so if we say the hospital is fully in operation, it means all these major directories have been established.
The ministry sought the financing through Ministry of Finance to get this money to implement the project, and the loan was declared effective. We roll out the implementation of this project. It was an EPC 10-key contract, so the ministry provided all the necessary technical support in terms of supervision up to the level of completion where we did the testing and commissioning to the point where the project was completed and handed over to the management of UGMC.
At the time phase 2 began, phase 1 had ended, but government had not paid all that was owed but originally it was meant to do.
UGMC is unique in the sense that UGMC essentially has 3 components. So, of various kinds of healthcare professionals, and then it has a research center. And so to the extent the service that we provide, the client is at the center. They are our focus, and we make sure that
it's a teamwork. We have the cardiac anesthetists, we have the specialist cardiac nurses, we have the cardiologists, and we have the surgeons. We all come together to decide on a patient. It's unique that we meet 3 or 4 people to take care of one patient. We try to offer cost-effective treatment. We don't want to be too expensive to offer you the best. For heart surgery, we want to even beat down the price so that we can offer the service to as many Ghanaians as possible.
Here in UGMC, our policy is that Once you come here and you are diagnosed, we will make sure we'll find your medication for you, and anything concerning the treatment, we will teach you, make sure you know how to use them.
We have medical school.
We train health professional students, medical students, dental students, allied health students, nursing, pharmacy students, practicing health professionals, the lay public who.
In Ghana here, we want to be the center, the research hub, to be able to get these large clinical trials.
My name is Nana Yawapia.
GMC is to have a baby. This place was recommended to me by my sister, and indeed when I came, I mean, everything she said is true. The nurses here are nice, the doctors are nice. Having my baby, I was scared. I wanted to have a C-section and all that, but the team of my said it did so well. I mean, it did stall, but you know, it was good. It was for my own good, and I'm glad they actually did that, and I was able to have my baby successfully. And so yeah, GMC, midwives, nurses, doctors, I would say from my experience, they are the best. And if you want to have your baby, I think you should.
And whilst the patients are in, we triage here. Triage is based on the patients, how we respond urgently to the patient's care.
So guys, you've seen these facilities and you see how intentional the people of Ghana are, or the government, or even the people living in Ghana are to their environment, to what they have. The government hospital here in Ghana is second to none. The facilities, they have all facilities. The way they treat people, the way they welcome people into their facilities, into the hospital, is second to none. And you see some Nigerians over there complaining of how the government do not care, or how they do not have the basic, like the hospitals and many other things. A lot of Nigerians, I'll be sharing subsequent videos on this channel for you guys to see where Nigerians are complaining bitterly. See, when I see all those things in Ghana, I wish my own country people, or my own country governor, or minister, or president can be able to do such a thing in Nigeria. To be very sincere with you, I am not saying they do not have qualified hospitals in Nigeria. They do, but mostly you see there is private hospitals. Most of these private hospitals are private owned hospitals, and when you go there as someone that is not buoyant enough, you don't have the money to go there. If you don't have the money to go there, you wouldn't be able to afford to pay for private hospitals in Nigeria. But to be very sincere with you again, Nigeria General Hospital are cheap. They are the cheapest to go to. But when you go there, there's some medications you want to get, you wouldn't see those medications. There's some medications they will have to prescribe to you to go get outside that they do not have here. And another video I want to share with you guys again is the health insurance scheme. Let's watch this video and we'll come back to the video and react on it.
In Ghana, especially government hospital. Take a look at how their government hospital is standard. They are building the hospital very correct, like European hospital. Government just because they know that health is very important to country. But I say, let me just come today and talk the reality and say the truth, so that I will be free. If you see country way past your country, way better than your country, doing progress, you have to appreciate that.
So guys, there's something I want to say here. This man came down here to Ghana and he assessed the government hospital. And to assess it, when you go to Ghana government hospital, they'll first ask you of your health insurance card. If you have your health insurance card, it covers most of the medical bills here in Ghana. But in Nigeria, to be frankly and to be so sincere with you guys, you know, I don't come out here to lie about things. I'll state it the way it is because I want my country to be better. I want something like this in my home country. And I'm not the likes of people that will see something that's happening in the country and I'll cover it up. I am not the likes of those people. If you see something that is happening that you don't like, or you see something in another country that you want that particular thing to happen in your country, you talk about it. You will say, oh, I wish my country has this. Same thing I'm wishing my country has the health insurance scheme. The health insurance scheme is only for the people that are working for the government in Nigeria. And even if you are to access any health insurance card or any health insurance scheme, it will be a private health insurance scheme in Nigeria, and you have to pay outrageous amounts of money to be able to access it. As a Nigerian, when I see all those things that is in Ghana here, the health insurance card that covers most of the bills, how the hospital environment is well kept, how everything is well organized here in Ghana, I wish all those things can be brought down to my home country. I wish that my own government is so intentional, has the people at heart when it comes to health in my country. And that is the reason why you see a lot of people, when they want to do some major surgeries, they travel out to India. They travel to India. In my home country, Nigeria, they travel to India to go do the surgery that is needed for that particular kind of thing. The hospital that we have here in Nigeria is not enough for the people of Nigeria. There are some we have in Abuja. I think we have one for people that are kidney-related issues. They have one major hospital in Abuja. Imagine everyone going there, and most times they don't do the kidney transplant there. They will have to shift them to India. So Nigeria that is stacked the giants of Africa. I expected a lot from you. I expected much from Nigeria. I know people say, oh, Nigeria is overpopulated. Population does not stop you from developing your country. Population does not stop you from creating something good in your country. Population does not stop you from giving your people access to quality health care, quality education, good environment, security. Population does not stop that. So when people come out here and say, oh, population, Nigeria is overpopulated, that doesn't mean the government cannot do anything. In as much as we are populated, it means there should be money in that country, because people are paying their tax. There are a lot of businesses here in Nigeria. People are paying their tax. So the government needs to have money to do all those things. You know, the governments are supposed to have money to do all these basic things for us. When I begin to compare Nigeria and Ghana, a lot of people will say, oh, don't compare Nigeria to Ghana. Don't compare, stop comparing. I will keep on comparing till I see a change. So eventually I see, oh, Nigeria are beginning to do something. Citizen, I will come out and talk about it. I am a lover of good things. When I see good things happening to people, I come out to say it. Same thing, I want the health insurance scheme to be established in Nigeria for all citizens of Nigeria. It shouldn't be for just government workers or people that have money. Here in Ghana, the poor people have access to health insurance. The poorest of the poor people have access to health insurance. It is unless they don't want to apply for it. I just hope everything becomes good in my country, Nigeria. And if they are not doing well, the Minister of Health should resign, or he should go for classes. You should go for classes, because I'm tired of every time people are leaving. I've seen Nigerians that left Nigeria to Ghana for medical attentions. You know, they are looking for the best of the best hospitals. They can't travel to India. They look for a nearby country that is closer to them, and they go to Ghana. They are well qualified doctors, nurses in Nigeria, but a lot of them have jackpot. Jackpot means a lot of them have traveled out of Nigeria because they are underpaid. And I think this is to all African countries. Most African countries do not pay their nurses, their doctors well. So they should do better in that aspect. Let African countries do better in that aspect, paying their doctors, their nurses very well. Because once they leave the country, who is going to take care of the people that are here? I don't have anything else to say on this video. Please give this video a thumbs up for me. Subscribe to the channel. Turn the post notification to get notified whenever I post amazing content. I'll see you guys in my next video. Bye.